Hello, everybody. This is Brian Devine from Topline, and today I have with me Dr. Dongieux, who practices in New Orleans, Louisiana, an orthodontist there. We're going to be talking about orthodontics and, of course, what makes ELI Orthodontics unique. So, welcome, Dr. Dongieux.
Welcome. Yes, sir. Thanks a lot.
Okay, I'm excited to have you here. You know, whenever we get started with this, I always like to start by having you tell us a little bit about yourself.
Well, I'm an orthodontist. I've been an orthodontist for 50 years. I graduated from Loyola Chicago.
Okay.
Treated over 20,000 patients. Before I was an orthodontist, I was a single-engine jet fighter pilot in the Air Force.
Wow.
Was on active duty for 3 years and flew in the Air National Guard for 12 years while I was going through dental and orthodontic school.
Very good. And you've got a pretty large family, is that true?
Oh yeah, I have 5 kids. I have 12 grandkids. My oldest child is 60. My youngest child is 15.
No kidding. All right, keeping you young. Tell me about ELI Orthodontics. What does that mean?
Eli means everything looks incredible. And ELI Orthodontics is a little bit different in that we feel that our product is a lifetime satisfied patient. So we want a patient that is interested in having a beautiful smile, but is also interested in being happy coming to their appointment, coming on time, cooperating, keeping their teeth clean, going back to their dentist, and being followed up and not having their braces removed until they're real happy with the result.
Very good. Very good. Now, let's say I'm watching this interview. It's getting to know a little bit about you. But what would I want to look for if I'm looking for a good orthodontist? What should the average person be kind of keeping an eye out for?
Well, he first off, he'd like to have a free consultation. He'd like to be able to come in and actually meet, see the facility, see the staff, visit with the doctor. And in our particular case, we do a free panoramic X-ray, and the consultation, we answer the questions that we feel like the patient would ask, which is what's wrong, can it be fixed, how long it takes, how much money it costs, and how the money is paid. They also want to know what products we have. You know, they want to know, do we have ceramic braces or steel braces, or do we do Invisalign, and do we bleach the teeth? So, and essentially, we like to see children that need orthodontics right away, and maybe are suspicious about whether or not they're going to need orthodontics.
Okay, so when someone is kind of watching this and they're thinking, how do I find the right orthodontist? What you're saying is the best thing to do is to go meet the orthodontist, meet the team, find out kind of how everything's going to work, and at the same time, don't make that sort of a working visit where you get the free exam, you get your X-rays, and then you really get to learn what your treatment may or may not look like, and if your child, if it's not treatment for you, but if your child is looking for treatment or needs some help, that maybe we can do something a little bit early.
Yeah, well, there's a misunderstanding about when patients should actually see the orthodontist. You should see a child at, say, age 6 if they have a skeletal deformity, if they have a problem where their teeth are out so far that they may get broken off at the water fountain at school, or if the lower teeth are biting in front of the upper teeth. They call that like an underbite. So skeletal problems need to be seen early. The early loss or over-retention of baby teeth can cause you to need an orthodontist. So it's important for a person to be sent to the orthodontist for eruption guidance, and that way the orthodontist can take the free x-ray and can let them take it to the dentist if certain teeth need to be removed to minimize or to even prevent the child from having to have orthodontics.
Okay. So I mean, I know I've heard a lot about early treatment. And I think it's important for those that are watching that they're kind of hearing that this early treatment or early prevention is not just about getting you in the door early, but it's about really doing more for the young patient, for their children, and maybe making life a little bit easier during those teen years where normally they would be in full braces.
Yeah, well, of course, the first thing that has to happen is that the child does need to see the orthodontist at a different age than when they've lost all their baby teeth, because there's lots of times the teeth are stuck up in the upper jaw or lower jaw, or teeth are tilted because baby teeth have been removed or fallen out or have decayed or whatever, and the orthodontist needs to do eruption guidance so that the child can either miss braces or can wear them for a shorter period of time, or can be evaluated and see that it's a really difficult case and will take a real long time.
Okay. Now, let's say I've watched so far and it feels like a good match. Maybe I'd like to call the office. What can someone expect on that first phone call? Because I know things are a little bit different when they call your office.
Well, what we are interested in is we're interested in the patient feeling like this particular office understands the patient, and that they'll get what they're looking for when they come to the office. First off, they have to like and trust the dentist. They have to take a look at the physical facility. They have to see how the staff performs when the patient and parent are introduced and when the x-rays are taken. The orthodontist has to put his hand on the parent and say, look, don't worry, I'm going to take care of your child. You know, the different thing is when a patient calls my office, I'm not interested in my staff saying, well, we have a 9 o'clock and a 3 o'clock and we have a Tuesday and a Thursday. I'm more interested in them creating a relationship on the phone so that the patient or the potential patient says to themselves, wow, that's the place I want to go. These people are familiar with what my problem is, and they care, and it's not just like a regular machine answering the phone.
Very good, very good. And so that's really what I wanted to kind of get to, is that when somebody does call, and I think most offices offer some kind of a free exam, and yours is nice where you offer free exam plus the panoramic x-ray, which is really great. But that when they first call, that they can ask some questions, that it's not purely going to be come into the office. They can talk a little bit and get a feeling, find out sort of what that's going to be like. For those of you that are watching, give them a call. The number is 504-835-CARE. And that's 504-835-2273. Give them a call, ask some questions, set up that free exam, get the free x-rays, find out what it's going to look like to have the perfect smile for you or for your child. Dr. Dongieux, thank you so much for taking the time to talk with us today.
Oh, you're so welcome, and thank you for letting me do this.
Absolutely, and I look forward to doing it with you again. Have a great one, everybody, and thanks for your time. Bye for now.